Hi, everyone. Thanks so much for joining us. I'm really glad you're here. This podcast exists to educate you about mental health, therapy services, and how to be an informed consumer. That's why this podcast exists. So thanks for being here. If this is your first time, so glad to have you here. If you're back, welcome back, and please keep coming back again. Let me tell you about our episode today. We are actually going to talk about the use of media. So, how you as a consumer can use what you see online to help learn more about what therapy services are like, maybe how to learn more about a provider, just so you can have as much information as is possible. I always like to be an informed consumer. I want all of you to have that as well. So, we have a lovely guest here today. We have Rahim Thawer, who is a registered social worker and Canadian certified supervisor who works as an instructor, psychotherapist, consultant, public speaker, podcast host, and writer. Wow, really kind of lazy there, aren't you, Rahim? You're a busy human. He founded, and you use he, him pronouns, it looks like. He founded Affective Counseling and Psychotherapy Services in 2014 and has delivered nearly 200 presentations and talks since then. That's incredible. His community workshops have inspired critical conversations and opportunities for reflection on mental health, interpersonal effectiveness, systemic oppression, and innovation in queer relationships. I love this. Affective is currently focusing on DEI consultation and training services for nonprofit organizations and healthcare centers. Thank goodness, as DEI has been sort of swept out the door. I'm really glad that you continue to help people understand what it really is. I mean, my goodness, when did empathy go out the door? I just don't understand. Rahim was a co-editor of Any Other Way, How Toronto Got Queer by Coach House Books, which was nominated for the Toronto Book Awards. More recently, Rahim has self-published 4 clinical guides related to assessment, treatment planning, documentation practices, and using reflexivity and examining countertransference. Oh, okay, we need to have some conversations. His latest book, The Mental Health Guide for Cis and Trans Queer Guys, was released in June of 2025 through New Harbinger. Congratulations on that, and welcome, Rahim Thawer.
Thank you so much for having me. It's great to meet you, Madame Margot Janko.
Merci, monsieur. Très bien. Much appreciated. So, my goodness, as is sometimes the case, I read somebody's bio and then I think, I want to have 12 different conversations with you. So, perhaps we'll be pals and you'll come back. That would be lovely. But for today, you were kind enough to agree to speak with us about the use of media in educating people about therapy. So can you just give us a little intro from your perspective of what that's all about?
Yes, absolutely. So there are a lot of folks who are on TikTok, Facebook, Instagram, and they've been quite successful as content creators. And when I say content creators, I mean not posting selfies of, drinking coffee, but creating content that relates to a particular subject matter. And there's been an explosion of that in mental health. I myself am not much of a content creator. I tend to use social media to promote some of my work or some of my services. So my entry point is a bit different. But I'm here to talk about content creation because 2 things. 1, content creation on social media has changed the landscape of what therapy looks like. And so we can talk about that and how people bring issues, conversations, topics, theories that they found online into the session. And we need to learn how to work with that. And people need to know that it's appropriate to do that. The other thing is that I want to talk a bit about is the CBT Dive, which was a video podcast that I did. I had about 30 or so episodes before I called it quits because it was very tiresome. But what I wanted to do was create something illustrative for social workers and counseling student trainees on how to use a cognitive behavioral therapy thought record. Being an instructor at the undergraduate and graduate level, I find a lot of students have misconceptions about CBT and how to use it. And I find most of their misconceptions or most of their frustrations come from their own experience of getting stuck in using the tool and less from, using the tool appropriately and then evaluating it to say it was not so helpful for my client. And so,
Mm.
I wasn't that big of a fan of CBT before I even started the podcast. And then I really got into it because I thought we're gonna settle the score here. We're gonna show folks how to do it well. And what was lovely about it, and this is what got me excited about using media for education, was that people who were guests on the podcast, some of them have never been to therapy before. And then they shared their video or their recording with people in their community. And so it
Mm.
conversations for them around mental health, around the things they struggle with. And even though I stopped creating episodes weekly, I see there's like 20 to 50 downloads across the various episodes. So people are getting something from it. And I think that's cool.
That's very cool. I mean, the fact that people are still downloading it, you finished, the fact that you got 30 episodes, that's really impressive. So we can talk some about cognitive behavioral therapy and we can talk some about the use of media. Because to your point, Rahim, people do come into sessions and say, I saw this thing online. I saw somebody do EMDR, which is eye movement desensitization and reprogramming. I saw somebody do cognitive behavioral therapy. I saw somebody do exposure therapy. And so this is what I saw that it looks like. Is that how you do it or not? Or what else they bring in? It used to be, to date myself a bit, it used to be people would come into session and say, well, Dr. Phil said, blah, blah, blah. And how come you're not saying blah, blah, blah? I was like, well, look, if yelling at people and just scolding people worked, you'd come in once, I'd do that for you, we'd be done. I will tell you that doesn't tend to work and you probably wouldn't come back. But so how do people know how to find good content in terms of what they're looking for? And how do they then bring that into their therapist in a way that is useful? And how should a therapist respond? There, that's 3 questions. Got it?
Let's see if we can do this.
Yeah,
So
right. Exactly.
in terms of evaluating content online, if something resonates with you, that's great. Read it, save it. But sometimes we think something is so good, we have to share it immediately. And there's nothing wrong with that. But if you think about just an emotional cycle in your body, sometimes you share to extinguish excitement or anxiety, some kind of arousal. And I would say sharing isn't bad. The content creator appreciates it, but use that additional arousal to do a bit of a Google search to see if you can learn more about the topic beyond what the person is saying. Because social media is designed for sound bites, and it's really good for, like providing something that the end user can metabolize quickly. But if it's going to be useful for you, you really need to do a bit more reading and contextualize it for your life. Otherwise, it's like reading, even if something is good content or it seems nuanced, without a bit of a deeper dive or contextualizing it for your life, it's like reading an affirmation card. And let me tell you, I freaking hate affirmation cards. They drive me bananas. Like, looking at the mirror and saying you are loved, like, it may or may not be helpful, and that may or may not be true. It might be
Exactly.
and you need to work on grief. So,
Right.
yes. So that's one thing. The other thing is it's really important to appreciate that you can like somebody's content and they can be really smart in one area of life and not be a great human overall. We're in a place in the world where our entire character is being evaluated. And we're not just putting out a book. We're not just putting out a podcast. People who are content creators become ongoing daily influencers. And I think while that's nice for them, that's also a lot of pressure. And we have to remember that they will disappoint us. This is what happens in any kind of idealized relationship. It happens friends with the therapist who you thought was going to solve all your problems. It happens when you first meet a partner and you think they're going to fit into your perfect life. It happened to you with your parents until you reach adolescence. And then you were like, oh my gosh, they're human. You will be disappointed, right? So somebody could have a lot of expertise in one area, and then they could say something that doesn't fit with your political values. They could say something racist. They could say something perhaps unintentionally slightly homophobic. I don't know. My point is that people can be good in one domain But we need to be cautious about buying into the personality cult because it actually is going to then undermine the value of the good content they put out. So
Right.
we can't stop them in their tracks because that's how they're building their whole career and persona. But as consumers, we need to be aware of that. How do I idealize and then devalue? That's something you don't want to do in any of your relationships, really. A lot of them should live in the gray.
That's great. So, a couple of things. What you were just saying, there's a saying in 12-step programs for recovery of take what you want and leave the rest,
Mm,
which I know when it's political or right, that can be rough, that can be a rub. And if there's something useful that can be helpful for you, hopefully you can take that and
yeah.
just leave the rest of the garbage that doesn't resonate for you. I love the fact that you talked about the arousal in your body. And folks, what
Mm,
Rahim means by that, there's, I think, a few ways that we can use the term arousal, but what you're talking about is in our nervous system, we can get activated, we can get excited, we can get angry, we can get stirred up. And so that
mhm.
arousal, you use the word excitement, it's just excitement about, yay, I found this thing that sounds so perfect. It completely encapsulates what I'm thinking and feeling. I'm going to share that right now. And your point is, if you see something online in media that is a soundbite, that is a video, that is a meme, that just captures something important for you, make sure you do a little deeper dive to
Yeah.
look into what the person is talking about. If you're
Mhm.
talking about cognitive behavioral therapy, for example, what does that mean? To your point, you got 30 episodes out of doing a thought diary or thought card. So I mean, there's a lot of ways to look at these things. Make sure you're doing that deep dive to make sure that what you're thinking about, what you're sharing is accurate. So, what are some of the common misconceptions, Rahim, about therapy that you've been able to address through media? Because you talked about the CBT stuff that you did. What else?
Yeah. Well, I don't create a ton of content, but when I'm in sessions with people and if there's like a reoccurring theme, I sometimes will take note of it and say, okay, I got to write a little paper on this. And so on Medium, which is a self-publishing platform for writers, I publish articles on envy and sexuality, shame and sexuality, how to support LGBTQ Muslims. I did a piece that I thought was going to be like one part of many, but it just was one part on porn consumption and how it connects to our experiences of socialization, envy, body dissatisfaction, and how the fantasies could be connected to potentially unmet needs. So as I get ideas in my own therapy, I think about how could I turn this into a paper? If I want something more soundbite like, I'll create a little carousel for Instagram. And I had recognized just a few months ago, I think it was in February or March, I had finished a session with a client. And in one session, they said, well, I have abandonment issues. And then later they said, oh, I think that's my codependency. And I was like, whoa, 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 whoa. You can't just say those things. Like, it
Right.
may be true. I have no idea what you mean by that. And the truth is, I do know what those things mean. It's my job to know what those things mean. I don't know where they found that language and how they applied it to their life. So I'm not dismissing it automatically, but I think when people bring things from social media, I might put something out there to clarify codependency. Somebody might read it and they might apply it to their lives, but they might apply it inappropriately. And so that is the tricky thing. There's some things that have really flourished in popular media, and that is language around abandonment, codependency, trust issues, daddy issues. And so I'm thinking, okay, it's okay to have some language, but let's talk about what that is. When you say codependency, have you heard the term interdependent? And how are those different or are they similar? And when you say codependent, are you worried that you're cultivating dependency? Are you worried that there's something about your personality where you fear being alone or you fear responsible for managing other people's emotions or outcomes? That could be a kind of codependency. Do you try to support people to the point of depletion? And because if these things are true, we could call it codependency, but that doesn't solve it. A label is like an externalizing experience where then we attribute behavior to the label and we might say, well, I'm not going to do anything about that. And I would be thinking, well, I think we have to talk about, from a psychoanalytic perspective, where did you learn to cultivate that dependency? How did you come to a place where you experienced gratification only when someone else was happy? We would call that a reversal as a defense. Do you understand yourself outside of a helping relationship? There's all kinds of questions we can ask to clarify. And I think that's a therapist's job. And I will be honest, I think that's also the consumer's job to come in and say, I think this is what I'm working with. I want to unpack it with you, as opposed to saying, this is what it is. Let's take it at face value. Because it just might not be it. And when it comes to abandonment issue, that one is used so much, and it can mean different things. Like, are you afraid somebody's going to leave? Doesn't mean you have an avoidant attachment style in that you prioritize yourself and you have difficulty with intimacy because you fear being left, or you fear the pain of grief, loss, rejection? Or do you cling to somebody because you are afraid they leave you? That same label abandonment issue, it can look like two very different things in terms of behavioral patterns. So I think clarifying it and being open to having a conversation about what that concept looks like in your life is really important, right? It's not just all boundaries and saying no. It's, how did I become this way? What do I get out of it? How does it mirror relationships in my childhood? There's much more to it.
Oh, folks, if you take nothing away, this nugget is gold, right? That you may watch videos, you may read content. And again, a lot of that is intended to be sound bites or informational, not diagnostic, right?
Yeah.
So it would be like your doctor, your physician would kind of need to do an x-ray, not just look at your hand to say, well, could this thing be broken? I mean, you want to go into it a little more deeply. One that I've seen frequently these days is dissociation, especially with young, like teenagers and young adults. They'll say, I am dissociative. And because they've watched something about dissociation, and true dissociation, folks, we'll have a whole episode on what is dissociation and how do we treat dissociation. But essentially, dissociation is kind of a normal thing that people do. It's like you drive from point A to point B, you think, gosh, I don't really remember a lot of what I saw because I was thinking about something else. That can be dissociation. A lot of folks are saying, well, I think I have multiple personality disorder because I sometimes feel differently than I do on other days. It's very complex. So I'm so glad you brought that up, Rahim. What are abandonment issues? What is codependency? What is dissociation? So bring that in. And if it can be a conversation, it's not the therapist necessarily saying you're wrong. It's just saying, let's understand that more. And who cares what we call it? What is it? And what do we do about it? So I love that. Thank you for saying that. So what are some of the ethical considerations that therapists ought to keep in mind? And then what are some things that our clients should understand about those ethical considerations? Folks who are listening, who might be going in for therapy, what should they be thinking about when they're thinking about online content? So some of this is, how do you think about it in a critical way, right? Having critical thinking. What are some of the ethical considerations?
Yeah. Look, it's going to also depend. I think we need to add the nuance of the different kinds of media therapists put out there. So if you put out a carousel of text, people will start to think about projection. And in the unconscious, what goes on in the transference is about our expectations based on previous experiences for the person that's in front of us or the person we imagine, right? So if it's text and it's got citations, there's going to be a transference around authority and expertise. And that's okay. That's probably what you want. But client might then reach out to you because of a post or because of the kinds of posts you have, thinking you have a background in research or thinking that you know all the topics you've posted about very well. They're not going to know if you pulled some of it from AI or if it was a stream of consciousness, if it's a theory that you are developing around colonialism, racism, or liberation psychology. Like, there's just not enough information about where it originated. It's not a journal article. It's never a journal article, right? You don't have the methods and you don't have the credentials. So as a therapist, you just have to think about what you're putting out there and how that influences how people see you. So I'll give an example of how this showed up in one of my sessions. I have a lot of content that is political, and I call myself the politicized practitioner. I had a queer person who came to see me for a few years. He was in therapy with me, but it took until like this month 7 or 8 until he told me that, I looked you up online and I saw that we have some mutual friends. I didn't follow you because you're my therapist. I'm like, okay, yeah, that's, great. But I was like, who did you see that we have in common? And he named some people. And I said, so interesting. What do you suspect my relationship is with those people? Or how did you think I was connected to them? And he says, well, they're pretty well known and they're also pretty political. And so you're kind of thinking we're all pals. And he said, yeah. Huh. And then I asked about when you think we're all in the same category and you think we're politicized and you think we're anti-racist and you have a sense of who we are, what does it mean for you to then be in therapy with me or a person from this collective group? And do you ever feel like you want to disagree with me, or does that feel hard? Do you feel judged by me because you see me as part of this group that knows? Do you have trouble sharing some things because you're worried about judgment? And, I'm summarizing it. It was much longer than that. But he was in tears saying that, well, he went into a dating scenario where he had rejected somebody. He wasn't sure if he was being fat phobic or if there was a racial bias. And I said, so you hadn't shared that with me earlier because this is part of the relationship. You have an understanding about who I am in the world, and you suspect I would judge you for that. So this therapeutic relationship actually activates a lot of shame for you. So I had to explore the transference in a way that was gentle and broke down all of the assumptions. And then later I said to him, in truth, those people I follow, I don't actually know them. I've met them once in my life. And sure, I talk one way on the internet, but I know that real people every day, they have racial bias. They struggle with fat phobia. Like, you're trying to make it out in the world. I'm not here to judge you for that. I'm here to be curious about it. But so I think as therapists, we really need to think. I know a lot of people don't get psychoanalytic training, but they are in clinical supervision. People do talk about the unconscious because that's where they go when they don't know what else to do anyway. So if you're thinking about the unconscious, we need to add this to the list. How did the relationship begin before therapy even began? Because that's when I looked you up on social media and started to form an opinion and an understanding of who you were. And that's where the transference begins. And so
That's great.
That could be a problem.
That's right. That is a great point, because folks, you probably will look up your therapist, perhaps do a Google search, not a bad thing. I think it's really good to dive in to see who is this person, just to see a little bit about what they think and what they feel and what they say. And is this somebody that resonates with you? To your point, then that person, the therapist might have posted some articles, they might have blog posts, and those may be things they really understand, or things that they just are familiar with, or people that they really know well, or people that they don't. So maybe in an interview on the front end, you might want to ask the therapist about their experience, about what do you really know about this? What is your experience with this kind of treatment or with this group of people? I think that is a great point.
The other thing I'll say is, we look up people online, and I supervise a number of therapists, and they've all at different points asked me, can I have this in my office? Can I put this on my website? What do you think about this photo? And I'll say, I know you can't pretend you're a blank slate because you're not, but things you put out there, just be prepared they're going to show up in the transference. So if you're a queer person and you tell people you're a parent, that will stir something up in them. And you should be curious about, before the session even begins, what that might be, and just keep a lookout for when it might show up. If you're you could find yourself in a difficult spot, right? Because people, for others who have a similar identity, and when there's a presumption of sameness, similarity of disadvantage, maybe similarity of privilege, whatever it is, you're looking for a kind of psychological safety. Like, this person gets me, yes, but when this person gets you, are there blind spots? Is there a shared collusion? Is there a thing you don't talk about? Is it because we're both gay men? When you talk about substance use, I'm going to be like, oh yeah, that amount of consumption is normal in our community.
Mm.
Good for me to know that consumption levels are
Mhm.
in my community, but am I colluding with you by not challenging you because we're from the same
Mhm.
community, you know?
Mhm.
Or if we're both queer Muslims and you want somebody who's a queer Muslim, what's going to happen in my countertransference, meaning how I react to the ways you do things, the decisions you make when they're different from my own, will I get activated? When I hear your trauma story, how will it land in my body? Right? I think when people work in communities they belong to, ethically, they really need to think about the weight of the countertransference and the transference. It is
Mhm.
uniquely exhausting. And I don't think we
It
have
is.
that.
That's such a good point. It is uniquely exhausting. And when someone looks us up, uses media to try to understand us better, they might come to us with certain assumptions about who we are, how we think, how we feel, how we're going to react. You're like me, therefore, we're going to have a great relationship. When sometimes maybe we need somebody who isn't exactly like us, or maybe we do. But your point, I think, is a good one. And folks, I would suggest, and I think this is what Rahim is saying, be aware of what that
Mhm.
is. As a consumer, as you're choosing a therapist, why are you choosing somebody so similar to you? And what might that be like for both of you? What if in my similarity to you, I disappoint you because I'm not exactly like you in the way you thought I would be? That's a great
Exactly.
point. It's a
And,
great
you know,
point.
if you pick somebody because they're attractive, that's okay. But
Right?
be prepared. You're going to get into the therapy. And then you should ask yourself, how does my attraction to this therapist get in the way of talking about what I really want to talk about?
Right.
Just because-
Exactly.
What does their approval mean to me? What would it mean if somebody who looked like this person said all the right things to me? Am I more
Mhm.
prone to feel rejected by them? It's not about what choice you make, it's about the curiosity that comes with the choice.
Mhm. Mhm. That's it exactly. Rahim, these are all excellent points. I really appreciate your perspective. And folks, these are some things I hope you'll be thinking about and being curious about as you're seeking out a therapist, as you're using social media or media to make your choice and or to look for somebody who does a type of therapy that you think is important for you. So, Rahim, top 3 suggestions for our listeners if you're going to go find a therapist, if you're using social media or media to look at a different kind of treatment. What are your top 3 suggestions?
Okay, so one is for content creators who are practitioners in mental health. Use citations and include references. Just because it's social media, it's important that you don't rely on that authoritative transference that comes with your following. It still needs to be rooted in something. And if it's just your theory, say so, right? So clarity around that. The second thing I would say is when content creators provide information, like it's important to have a balance between insight and action. The second thing so I'm going to give you more than 3, I think. Another thing I would say to content creators is, what is your goal, right? Are you trying to build a public persona because you then want to do public speaking? You want to inspire people? You want to be an educator? If you're trying to get referrals for your private practice through social media, be careful. That might not be the best way to generate referrals. And if you're giving a lot of yourself away, not just in a carousel, but you're doing TikToks, people are seeing videos of you in your everyday life and they're forming all kinds of ideas and opinions about you. And that might actually work against the kind of neutrality needed to forge a new relationship. So
Interesting.
for people to be aware of, in a social media world, people know you before they meet you. And so be aware of what's going to show up in the transference. And if you are going to work in a community you belong to, think about what the unconscious pressures, weight, expectations of all of that is in your body.
Mhm. Mhm.
But folks, for people who are on the consumer side, I would say asking your therapist questions is great, but also do a little bit of homework on what the different modalities are and what you're looking for. Lots of people will say, I don't do psychoanalytic therapy, but then they spend a long time talking about early childhood. I think we should just be aware of what the modalities are, because lots of people will say, I do something eclectic, and that's okay. I'm integrated approach. I do a bit of this. I do a bit of that. It's okay to also ask your therapist and say, you mentioned you do CBT. I think from what I understand, that's a very linear, structured way of looking at something. Can we introduce that in our coming sessions? Just to
Great.
make sure you're getting what you hoped for. I think one thing that clients do and the therapist colludes with, and this is separate from social media, it's once the relationship feels good, sometimes clients will log in and they'll just give you a weekly update on their life. And the therapist will, I say collude because we're both doing something. I'm not looking at the treatment plan or talking about the hard stuff. And you've conveniently forgotten about the hard stuff, or you have a real / manufactured crisis every week that makes us avoid talking about what our goals are here. So
Exactly.
to think about like that relationship and really put some effort into it. I think, if you want somebody who's got similar identity markers to you, that's very reasonable, right? You want somebody who understands certain things. I get that. That comes with a certain amount of psychological safety. But as the consumer, as somebody looking for therapy, be prepared and think about how you might idealize your therapist and how just wait for the moment, months in, when they might disappoint you. They'll miss a session, they'll cancel, and you'll bring it up with them because you should. But that rupture is not a rejection of you. It is a necessary rupture so that the idealization gets balanced out and you can start a different kind of work.
That's wonderful. Boy, we are at the end of our time, and I have like 20 other questions for you, Rahim. This has been wonderful. I think the takeaway really, folks, is do some homework, come up with realistic expectations, ask questions. You don't have to just follow what you're being told. Make sure that you ask something on the front end so that you and your therapist are on the same page, and do that throughout the course of treatment, but have realistic expectations. I hate to say it, folks, but all of us therapists, we're just humans too. So we're going to have our days.
Really?
Rahim Thawer.
I think being superhuman.
Well, I like to think that of myself too, but ask my kids. Today is not that day. Rahim Thawer, thank you so very much for your time, your wisdom, your experience. Much appreciated. Folks who are listening to this, thank you for joining us. Please like, please share, and we will look forward to having you with us next time.